Scene 1.
Ma, are you okay?
Can you take my medication, please?
Where is it?
In the cupboard.
Oh, okay, I will take it.
Okay.
Mom, is this your medication?
Yeah, it's true.
But I think it's already finished.
Oh no, I really need medication.
May I know why are you taking this medication?
Oh, actually, my daughter-in-law, I have hypertension.
Oh, really?
Yeah.
So do you want me to take your medication tomorrow at the pharmacy?
Yeah, it will be very helpful.
Okay.
In the evening, Alia went to a pharmacy and bought Pindolol to her mother and Panadol to her husband, who is currently having fever. Scene 2.
Dear, are you sleeping? Please take your medication before you go to sleep. Come on.
Okay. Where is the medication? Maybe this one.
Oh no.
Her husband mistakenly took Pindolol instead of Panadol.
Dear, what happened, dear? I heard you screaming.
I'm having a nightmare, honey. It's so scary. A group of tiger chase after me. Ooh.
Oh, it's so scary. But why suddenly you got nightmare?
Maybe because I'm asleep in the afternoon.
Maybe.
Scene 3. Alia then went to the pharmacist to ask regarding the drugs.
Okay, ma'am. Please wait for a while and I'll check the record.
Okay.
Okay, it states here there's no relationship between nightmare and Pindolol. But I think I will discuss with my colleague and I'll tell you later, okay?
Okay. Thank you.
Okay.
In the office,
Guys, we have a problem.
What's the problem?
This is for a second.
Alright.
Actually, we received a report from our customer regarding our drug,
Oh, what's wrong?
Pindolol. The patient complains about having nightmare once he takes Pindolol. So for now, I think we need to stop our production first and let's find the evidence on how it can lead to nightmare. So I give you 1 week to find the evidence and we'll meet later.
1 week later.
I assume you had done your part, so let's hear from each of you. Okay, first, Aida.
I will explain about the discovery of beta blockers until the emergence of Pindolol. The discovery of beta blockers begins on 1948 when Alquist proposed that there are two different types of receptors, which are alpha and beta, that cause different responses in the heart muscle. But only then in 1960s, Dr. Black picked up on the theory developed by Raymond Alquist that has been ignored for years. He focused on beta receptors and founded propranolol and also brometalol drug as beta blockers. Then in 1964, the treatment for angina pectoris was dominated by propranolol. Since then, it was also widely being used as the treatment for arrhythmia, hypertension, and also hypertrophic cardiomyopathy. However, due to the adverse effect developed by propranolol, it induced the designation of new drug, which is Pindolol. Pindolol was introduced on 1969 and during that time, attention was only given on its cardio effect of beta blockers, which is to treat angina pectoris, arrhythmia, and hypertension, while the properties like membrane stabilizing action and intrinsic sympathomimetic activity or ISA was not really being considered. During 1969 also, Hill and Turner conduct an experiment on comparison of effect of Pindolol and propranolol on healthy people. As a result, Pindolol caused less reduction in heart rate compared to propranolol. That was the first evidence of Pindolol's ISA in men, which shows the partial agonist activity of Pindolol that weakly stimulate both beta-1 and beta-2 receptors due to its ISA properties.
Next is medicinal chemistry of Pindolol. Medicinal chemistry is important during drug design and synthesis, structure activity relationship, receptor interaction, and ADME, absorption, distribution, metabolism, and excretion. So for structure activity relationship, the first one is hydroxyl group. Hydroxyl group function as to make bonding with the beta-adrenergic receptor. The second one is amine group. Amine group is responsible for ionic interaction with the receptor. The third one is bulky branch and substituents. This structure is important for hydrophobic interaction with beta-adrenergic receptor, and this function for antagonistic effect. The fourth one is OCH2 group. OCH2 group function as to give the antagonistic effect, and it affects the ADME of beta-adrenergic blocker. The last one is the indole group. The indole group is that differentiate between pindolol and propranolol, as propranolol has naphthalene as their structure.
So next is about the mechanism of action of Pindolol. Pindolol is a non-selective beta blocker drug that is used to treat hypertension. It is a beta adrenal receptor blocking drug which is equally effective on beta-1 and beta-2 adrenal receptor, and it possesses partial agonist activity and also intrinsic sympathomimetic activity, which is ISA. A drug with ISA like Pindolol is capable of exhibit a low level of agonist activity at beta adrenal receptor, but simultaneously act as antagonist. Okay, so next, Pindolol block beta-1 adrenergic receptor mainly at heart and by inhibiting norepinephrine and also epinephrine levels that will lead to decrease of heart rate and also blood pressure. Meanwhile, when Pindolol binding to P2 receptors at juxtaglomerular apparatus, it will inhibit the production of renin. Thus, it will also inhibit the production of aldosterone and also angiotensin II. This will cause vasoconstriction and also water retention. So, in this case, this patient take Pindolol as she is also diagnosed as diabetic besides having hypertension. This medication can prevent beta blocker drug to fully block the receptor, which will mask the hypoglycemia symptoms such as shivering.
In general, Pindolol exerts partial agonist activity on the sympathomimetic pathway. Basically, it is used for the management of hypertension. Pindolol partially blocks the B1 receptor on the SA node, so this will reduce the heart contractility and cardiac output, which results in lower blood pressure. Besides, Pindolol is also prescribed for angina pectoris. It partially blocks the B1 receptor on the myocardium. So this will reduce the heart contractility as well as oxygen demand by the myocytes. So this will reduce the chest pain. Despite for its therapeutic effect, Pindolol may also associate with several adverse effects, Some of the common adverse effects are insomnia, vivid dream, muscle pain, fatigue, dizziness, and cold extremities. Not only that, Pindolol can also cause bronchoconstriction, in which abrupt cessation can lead to arrhythmia.
Alright, as regard to our discussion, it can be concluded that this Pindolol may cause nightmare and bronchoconstriction as its side effect. Do we all agree about that? Yes.
Okay guys, I think it's clear that Pindolol can lead to nightmare and also bronchoconstriction. So I think we can continue our production and I'll tell the patient immediately. So case closed. You may disperse.
The end.